just people kind of know about TENS devices, right? It's kind of like electricity aspirin, right? And that's kind of is that the brake and the gas pedal at the same time? And how's your electric current different?
So a TENS unit, it is like an electronic aspirin, the way most people use it. That's a great way to put it. They usually just put it on at a mild setting to try to distract or mask some of the nerve receptors there that go up to the brain that trigger ultimately within the brain the experience of pain. And so it's like a distraction. It's like it's like if you have a headache, you do something to your foot. Oh, you don't feel your head anymore because you're feeling your foot. It's
Right.
like,
Yeah.
it's like something like that. But
Yeah.
if you turn it up to a high enough level to really make a difference in neuromuscular re-education, in loading muscles and challenging muscles and teaching them to work in a new way by actually activating the underlying nerve pathways, if you did that, then you'd run into these hurdles or these roadblocks where you'd be causing the muscles to fight against each other because of that signal volleying back and forth, alternating current, and how that interacts with the nervous system. So that, in contrast, the direct current device, I'll show you, the newbie that
That's the newbie.
use. Yeah. So when we're using that,
Oh, I'm sorry. Can you put it up one more time? When I spoke, the video went to me. Go ahead. Try it again.
So we're using that there. So this puts out a unique direct current signal, and when that direct current signal is only going in one direction, it causes a much more controlled input of sensory pathways in the nervous system and a lot less of those contractions and co-contractions. And if we're talking about, certainly injury recovery, but even this notion of proactively helping make someone more resistant to injury, that's so important because remember, we want to be able to bend but not break. We want to be pliable and resilient. And so if we're stiff, then that means we're more likely to break and not bend. We're more likely to snap and get those injuries. Whereas if we can use technology like this to amplify that ability of the body to make the muscles more supple, make the tissues more pliable, that'll ultimately make the body more resilient. And I think that shock absorber metaphor that you mentioned is a good way to do that. So this can actually help us re-educate the neuromuscular system to become more pliable, so that we're not resisting our own movements. We're better able to lengthen those muscles to accommodate greater ranges of motion and to absorb force and protect those other structures of the body.
Excellent. So let me summarize. So you have a current that's going to be a direct current that's more harmonious with the body. That's like hitting just the gas pedal, where an alternating current, which is what you see maybe with the TENS unit, is like hitting the gas pedal and the brake at the same time. And it's more just, it's like white noise in a room where people are talking. It's just kind of covering up that chatter or that pain input, where this is actually providing stimulation for oxygenation, which helps tissues heal. It's driving blood flow as well, which provides nutrition in and pulls inflammation out. And then you're also, and I know a little bit, guys, because I did this technique when I had a physical office for many years. I believe in it. I wouldn't be sharing it with you guys if I thought it was something that wouldn't be beneficial. When you are doing scanning of the device, you're also finding specific compensation patterns. So we're not just smacking a pad or an input onto a muscle. We're specifically scanning so we can find those areas that aren't communicating well, so that there's a specific way to target that. And I really want you to show that. And I also want to highlight one thing with the newbie that's amazing. There's double the amount of outputs that you would typically see on other devices. And this is what really makes it awesome, is with other devices, you'd have to have two machines to do what you can do in one. And I think that's really, really profound. As a clinician, you don't think about it, but it's amazing if you're treating patients, upper body or lower, or patients at the same time. That's really cool.
Yeah, absolutely. So